The National Department of Health says part of the funding for the national health insurance will come from money that South Africans are currently paying towards medical aid schemes. The National Assembly passed the NHI Bill last week. However, the bill still has to make its way through to the National Council of Provinces before being sent to the President to be signed into law. And many questions about how the bill will actually function remains unclear. Deputy Director General for National Health Insurance at the Department of Health, Dr. Nicholas Crisp, says NHI says there are three major sources for NHI funding. Well, from on this, we are now joined via Zoom by author and political analyst, Dr. Ebrahim Harvey. Dr. Harvey, thank you so much for joining us. A very good afternoon to you. Look, Parliament has approved this bill with a litany of course, mixed reactions, mostly against it. What is your reaction to it, Doctor? Should it really be passed, do you think?
No, you see, you have to draw a distinction between, in principle, who can oppose this initiative, you know. You must remember it's been there for about 2 decades and picked up a bit of momentum from 2019 onwards. But in the column News 24, which is probably why you're interviewing me, you know, of today, I indicated that I'll deal with your question now, but I think there's a political rationale and logic behind this. With the elections looming in less than a year, the ANC now wakes up, you know, to want to, you know, implement the NHI. I'm certain there are political calculations hoping to sway voters, you know, especially black working class voters with the NHI to vote for the ANC next year's election. But to answer your question, there will be a mixed reaction. And in fact, you will have huge concerns from the private sector, you know, the private medical aids, etc. Any attempt, I believe, so I have no principal objection, any attempt to socialize and to equalize healthcare must be welcomed. I mean, just look at public sector hospitals, you know, it's a total mess. Rahima Musa Hospital, I mean, what happened there, the Isidimeni crisis, the health sector, public hospitals are in a mess. And I think the ANC realized that they need this funding. They need this assistance from the private sector because they would have a massive amount of resources coming from the private sector into this national pool. You know, one can justify it, you know, because, I mean, arguably healthcare is the most important public service there is. Absolutely. So I don't have a problem with that. The big problem that I do have is that how is the ANC caught up in this unprecedented, unmitigated public sector hospital crisis? I mean, people are dying, lack of food, malnutrition, lots of problems, facilities, etc. Infrastructure is a mess, collapsing in public hospitals. How are they going to arrest it and deal with it through the NHI? How are they going to deal with, you can look at the Tembisa Hospital, the wanton corruption, mismanagement. How is the NHI going to deal with those problems? This is the question. And I don't think we've got answers as yet from government about those kind of questions. And this is what the private sector is raising. In fact, they're fearing that what's going to happen with the health standards of the private sector is going to inevitably decline, you know, with the influx of people who, remember, this is access to healthcare and that is not commercialized and commodified. So if you can't afford to pay for it and you're unemployed, you could go very well if you've got a private sector hospital close to where you live, say Tembisa, for example, you'd be entitled to go there and to seek it. I support that. The question is, how is the ANC government going to deal with this worst crisis in the pub? They need skills. You need skills, you need managerial skills, a whole range of competencies to implement what is going to be a complex health system with lots of layers, because now you have a combination of the state public sector with private sector. There are lots of things there, lots of complexities. I don't think, quite honestly, given the state of public sector hospitals at the moment, the state is ready to implement the NHI, and especially how will it deal with what has happened like at the Tembisa Hospital, Rahima Musa Hospital. You know, there's no answers.
Doctor.
And so we actually, yes.
Yes, Doctor. I mean, sorry to cut you off there. I mean, as you were talking about implementation, look, the main issue of contention here, which is unclear, is of course that, well, those that are opposed to the NHI, is that there isn't a sound financial policy or framework for the bill. Talk to us about these concerns. Are they legitimate, as you've just mentioned there, we're a country currently battling with corruption?
No, they are totally legitimate concerns. I mean, I'd be surprised. The private sector are not, those are not fools. They're way ahead of the government in terms of thinking around these issues, because precisely also the private sector, is driven by money. You get the best health care because you can afford to be part of a medical scheme. So this is the question. How is that going to continue, the standards not decline, and at the same time spread the facilities and the resources of the private sector into the public domain, and, for example, allow people in black townships who are close to private sector, private hospitals, to be using their facilities, at no cost. It's going to have a massive financial impact. And this, I think, is the concern of the private sector. And I think it's legitimate, and especially legitimate because if you see how much resources have been pillaged and stolen from the public sector. I mean, there are lots of things, even the Department of Health, the digital vibes saga, lots of issues, and it is those concerns that I have, not in principle any objection to the NHI. I support it completely. It's how it's going to be implemented and how is the ANC government going to respond to the legitimate financial issues and concerns that the private sector is raising. It has the right to do, and in fact, you're going to have a decline of health standards in the private sector once you have a single system in which resources are pooled, but they have to deal with two twin problems afflicting the public sector. That is the lack of skills and competencies to implement it, and what to do with the ongoing corruption, maladministration, and incompetence that we've had in the public hospitals.
Dr. Harvey, thank you so much for your contribution there. That is Dr. Ebrahim Harvey, live to us on Zoom, weighing in on the NHI bill.